The death toll from the Ebola outbreak in West Africa keeps climbing to staggering levels. The World Health Organization says another 400 people have died from the disease, bringing the death toll to 1,900. The outbreak could infect another 20,000 people. The WHO also says a doctor in Nigeria may have exposed dozens of his patients to Ebola before he succumbed to his disease. His wife has begun showing symptoms. Another 60 are now being monitored. And Dr. Rick Sacra is the third American who got sick by the deadly virus. He was treating patients in Liberia. It's not known if he'll return stateside for treatment. U.S. human trials are starting this week for an experimental Ebola vaccine. Its safety will be tested, as well as its ability to generate an immune response in patients. At least 20 adults will be included in the trial. Officials hope to have results of the trial of the test by the end of the year. Joining me now via Skype is Dr. Arthur Kaplan, Division of Medical Ethics, Director at NYU's Langone Medical Center. Dr. Kaplan, with the virus spreading so quickly at such a dangerous rate, when 2,000 people almost have died, will a vaccine really make a difference at this point?
Well, I'm sorry to say, I don't think it will. I think it will prove to be difficult to manufacture it in any amount that would really help us get a handle on the current outbreak. The best steps right now are still travel restrictions, quarantine, using goggles, wearing masks, lots of disinfectant, taking precautions when burying dead bodies. A vaccine, even if it's safe and even if it gets some immunological response, you need to produce it in vast amounts, and I don't think that's going to happen really until next year.
So what are the challenges of producing a vaccine on a mass level when there's such a high demand?
Well, think of it this way. It's not as if there's a factory that is empty right now waiting to make a lot of vaccines. You either build one to do that, which takes a lot of time, or you switch over vaccine production from something else and retool the assembly line so that you can make this. It may turn out that that's possible to do, although it may leave us short with respect to some other vaccines. But whatever is done, whether it's taking current facilities and putting them to a different use, it's still going to be the case that to make hundreds of thousands, if not millions of doses, it's going to take a significant amount of time, and you've got to make sure everything is safe. We've seen some plants shutting down in the vaccine space because they had problems with infections and contamination, so that requires care too.
So Dr. Kaplan, what is that experimental trials on humans? How does it work? Are there volunteers who are actually getting injected?
There are volunteers who will get injected. Some of them may be coming from the company that's making the vaccine. That's not an unusual place to start. And what you do is you take the vaccine and you take a small amount, give it to 3 people, watch them for a few days, make sure they don't have any bad reactions, then move on to 3 more, then 3 more, until you get to about 21. In the meantime, you're also looking over the next couple of weeks to see if they get immunity. So safety is first. You don't move from one group to the next until you're pretty sure the first group didn't have a problem, at least in the short run. Then you start looking over the weeks to see if you've got immunity.
So who decides how and when and where these doses should be made available once it's determined it's safe?
Well, in all honesty, we don't really have an international agreement about that. The people who got some of the scarce medicines that were around, we didn't have very much of that. Some of them got it because their organizations, the evangelical group that sent the American doctors over to Liberia, they asked, and other groups didn't even realize there was some experimental medicine out there. For vaccine distribution, there'll have to be a decision made, and it will go something like this. Do you give it first to doctors, nurses, funeral directors, people on the front line? Do you give it to people who are in contact with patients, family members, and so on? I think those are the likely first groups, but even there, we'll have to make some hard choices initially about who's going to go first.
It seems this vaccine did pretty well in trials with chimpanzees. What are your own expectations? Are you optimistic?
I think we're going to get a vaccine, and I think it's going to help us on the next epidemic. Right now, I think we're going to have to deal with containment, quarantine, disinfectant, good hygiene procedures, safe burial practices. That's going to help us cap this epidemic, and I think that's going to have to be the tools we rely on. I think the vaccine is overdue, and I'm glad it's coming, but I don't think it's going to make it for this, sadly, for this epidemic.
And Dr. Kaplan, very quickly, how soon do you think this vaccine will become available to the masses?
I'd look for it early next year. If it really works, early next year.
All right. Thank you so much, Dr. Arthur Kaplan.